All right. How's everybody doing this morning? Welcome to Austin. I'm Tom. I'm, like you mentioned, a news anchor here in Austin. I've never been so glad to be with NBC instead of ABC, given everything that's going on. But, we're going to be talking about benefits. And I just, before we get started, I wanted to share a little bit about my journey with benefits and HR. A couple of years ago, I had a major health challenge where I was losing my voice, and our HR team, I remember our representative said to me, hey, you might, this was around November, you might want to sign up for the short-term disability insurance. And I got that heads up. I did. I ended up using it the next year. Now my health is much improved, but that was just my personal connection with how big of a difference a great HR team can be. So I sort of want to walk you through our panel here. We have a great team of esteemed leaders. So why don't we go all the way at the end and we'll bring it around back this way. So go ahead, introduce yourself, who you work for, and a little bit about what you do.
Hi, everybody. My name is Carmen Amara, and I am the Chief People Officer at Yelp. I have been with the company for 3.5 years. We are fully remote, and I live here in the awesome city of Austin.
Thanks, Carmen. I'm Sarah Gonzalez. I am the head of Total Rewards for Zendesk. If you're not familiar, Zendesk is a customer experience and employee experience platform. I've been with the company for about 1.5 years. I split my time between San Antonio and Houston for my home bases, but we are a remote-first culture as well.
Thank you. Morning, everyone. I'm Enrique Oswald. I'm the head of Global Total Rewards and Mobility for Hitachi, a Japanese conglomerate. For those not familiar, it's about 300,000 employees, 80 billion revenue, given or taken on the currency exchange, right? I've been with the company for quite some time, about 18 years, which it's pretty typical in a Japanese company, right? But I've been in the role for about 6.5 years. So yeah, we'll cover basically some of those topics in a discussion in a minute.
Good morning, everyone. I'm Matt Jackson, Chief Growth Officer at Unmind. We are a global mental health platform based in New York, and I co-founded our US operations April 2020, and I've spent the best part of 2 decades in the benefit space.
I'm Mark Blevins. I'm the Director of Sales for the Curative Health Plan, headquartered here in Austin. I've been there for about 3.5 years and spent about 40 years in the benefits business in a variety of different roles.
All right. Thank you all. So we have a list of questions, and the format is I'll start it off by directing the question to one of you, and then feel free to jump in as we get the conversation going. But this first question is for Carmen. So I want to ask you, when it comes to accessible benefits, explain what that phrase, accessible benefits, means to you and to your company.
Yeah, it's a great question. When we think about benefits, it's really important to us at Yelp to make sure that we're designing benefits programs that meet our employees wherever they are in their employee life cycle or in their life journey, and that we offer benefits that are going to address the holistic health of the employee. And so we know that means different things to everybody, right? And so the principle of flexibility is critically important to us in trying to offer the most access to people about the things that are important and that they care about in the most flexible way possible, while also being good stewards, of course, of company funds, because as we know, and as part of the title of this panel is the cost of benefits they're already expensive and they are continuing to rise.
All right. If no one else wants to weigh in on that, we'll move to Sarah. How are you tailoring benefits to meet sort of diverse employee needs? Certainly everybody comes from a different walk of life.
Yeah, absolutely. And I think, when you're with a global company, it adds a little complexity and layers onto that when you start thinking about the different cultures that you have present, and when you have a strong global mobility, when those cultures end up in different locations than the ones that they started life in. So I'll echo a bit of what Carmen said of meeting employees where they're at, whether that's employees who want all of their care online versus seeing doctors in person. But also we really think about our vendors and ensure that they have the right networks to serve these multifaceted populations. Vendors that have, and networks that have doctors who are experts at serving the LGBTQ community globally, which is more difficult than you might think in some locations, right? Because of the cultural differences there. So really diving in and making sure when we're evaluating those vendors, we require them to answer those questions and we understand what opportunities they have in their network to serve the different people that we have in our employment, and that they can have access to that care when they need it and for whatever reason that they need it for.
Just to pick up on that and the accessibility point, I'll speak from a mental health perspective. I'll very much stay in my lane for this, but I think accessibility of certain benefits like mental health, it's really lost on me why there would be eligibility for a mental health benefit. Because in my mind, mental health is a human right? Like it's not, I shouldn't be given different access to mental health care based on a demographic or a level within an organization. And for me, accessibility to mental health care is huge. There is a big supply and demand challenge that exists within the mental health space. That I read recently, I think there's 1.6 billion people in the world seeking mental health care. Does anyone know how many mental health practitioners there are in the world, licensed? It's 1.2 million.
Wow.
So you think about the wait lists and how difficult it is to gain access to mental health benefits in the US. Like the wait lists are 6 months, 8 months, 10 months. So I think for me, putting in benefits, or I wouldn't even call it a benefit, something that helps drive access to mental health is huge as well.
And go ahead. Did you want to follow up on that?
Mental health and providing access to mental health is certainly a real passion of mine. And I would just say, like, one thing that came out of the pandemic that I think was a bit of a silver lining was that it brought mental health much more into the discussion within corporate America anyway. And so we too have, it is the one of the top 2 cost drivers for us at Yelp. So we too have said, how do we also offer mental health benefits outside of just the traditional mental health care plans in a way to democratize it? But the other thing in terms of accessibility is there's still a stigma around talking about mental health. So while it's more common to talk about it, it's still not as commonplace as talking about regular health care. So one of the things that we've done is like lead by example. I talk about my therapy in company-wide town halls, right? I talk about my own access to these benefits, encourage other leaders to do the same, because we need to make that conversation, make it more normalized to also get people, I mean, if you just even are offering the benefit, to get them to engage with it, so.
Well, yeah, we'll go, both of you. Henry, you can go first.
Sure. And I think I'm speaking now more from a global perspective, right? So you're right, the stigma for mental health, for example, and I've had the benefit of spending 6 years in Japan, including the pandemic years. So Japan has just as many mental problems as anyone else in the world. There's not much difference. However, the stigma of you coming up and admitting that you have an issue is pretty large. So when we roll out programs, it's extremely difficult to have one size fits all, right? That's one of the first problems. The other one is, in some locations, you might just not even be culturally acceptable. So for example, in the West, when we talk about the US, Europe, reproductive rights is a pretty fairly common standard approach to offering benefits. In other cultures, it's nearly impossible to even start a conversation for religious or cultural reasons, right? So if you run a global program, I think how you communicate it and how you tweak it locally, including the language, right, is of the utmost importance to make it successful.
Go ahead.
Yeah, from the health plan perspective, you all have to deal with networks and whatever else of mental health, and they are pretty restrictive in a lot of ways, just because a lot of mental health providers do not accept insurance. So one of the things we looked at to get out of the box on this was essentially to find a way to set it up to where people could pay cash, utilizing a credit card from us, and go in and work with these mental health providers to set them up on a cash basis, which they're more than happy to accept, and in essence, increase dramatically the size of our mental health network that we have for employees to utilize, because we know, as you all are saying, that this is an extremely important part of their benefits, and we really need to have the access there for them. So, we've looked at this, tried to determine what we can do. We've also started working with a couple of vendors as well, too, on the telehealth side that have a large number of providers nationwide that can utilize this, which we think is important as well, too. So the access part of it, I think we're trying to really look at and deal with and provide more for members out there.
And Matt, just, you mentioned, a couple of you mentioned that there is maybe still a stigma. It's maybe viewed as a perk, not a human right like you mentioned. What do you think these companies need to do, or society needs to do, to pivot to this being viewed as something that everyone needs to offer?
We're not in 25 minutes, but I think, Carmen, what you said is best in class in terms of examples of things you can do. For me, there's two things. One is stop thinking about mental health just as an individual thing within your organizations, because there's a Gallup study that shows your manager has a bigger impact on your mental health than your spouse or your significant other. When you promote that incredible individual contributor to a manager, how much training do you give them to be a better listener, a better communicator, to lead with empathy? Hopefully some of you say loads. Majority of you will say we don't have that built in. But if you focus on the manager layer of the mental health of your organization, you're going to help them create a culture that is psychologically safe, which is a word that's used a lot at the minute. But that has such a huge impact on your mental health, on how you show up each day to perform and under the asks that you're making of your people every single day. So I think don't just think of it of this individual perk, as you said. The other thing would be think about mental health for all, right? Everyone has an EAP, I hope, in this room, an employee assistance program. Average utilization, 2 to 4% maybe. Now, EAPs have had a bad rep. They were built in the 60s and 70s to deal with alcoholism in the workplace, and they're part why mental health is so stigmatized. What that 2 to 4% typically is somebody who's at point of crisis. Keep referencing loads of studies, so apologies, but McKinsey tells us that 1% of your workforce will need crisis intervention for severe mental health challenges at some point throughout the year. It also tells you that 24% are living with moderate mental health challenges that could benefit from a level of therapy or counseling, which leaves 75% of people that you're leaving completely alone because they don't have mental health challenges. So therefore, we don't need to give them anything. But what are we doing to stop those people from moving or transitioning into the other layers? So if you think about it like that and you look at, well, what do we provide from a benefits or total reward perspective for every single one of your employees, that'll make you think about the gaps that potentially exist. And that's just about proactive, preventative mental health. Prevention is better than cure. And I think, Carmen, you did good examples there where you make mental health feel normal, right? Sorry, one last thing, if I may. I always like interaction. We've all said mental health, right? Loads of times. How many of you immediately thought of stress, depression, anxiety? You can do a show of hands. So as soon as you hear that, right? That's not mental health. Mental health is the best thing about being a human being. It's how you feel love, it's how you feel joy, it's how you solve complex problems. Stress, depression, anxiety, they are all mental ill health. And it's a prime example of where that stigma exists, that we need to be using the right language and thinking about it in a very different way across our companies. Like I've hijacked
No, that was
the
great.
mental health.
That was great. Go ahead.
I think this is also, as benefits practitioners, this is an opportunity for us to get innovative and creative in the way that we can start to address some of these. In a past role, I've done partnerships, and we've brought, if some of you are familiar, Dr. Mark Brackett has a book called Permission to Feel, and it's all about acknowledging your feelings and learning to work with those as you go through the day, that it's fine to feel angry, it's fine to feel sad, it's fine to feel joy. Don't let that control you. But we, through our benefits program, brought him to be a keynote speaker and used, if you have some benefits reimbursement dollars through one of your care providers, we helped pay for the speaker fee with that. Then we worked with our performance management team and our manager enablement team and brought him back to address strictly managers on how do you enact this in the workplace? How do you check in regularly with your employees? How do you have those conversations? So we turned a manager enablement and benefits enablement into a joint partnership and brought that globally to our organization. And let me tell you, our manager enablement team was more than happy to find out that some benefits reimbursement could pay for this speaker, right? So find out how you can do this in partnership, because we can deliver all the programs we want as benefit specialists, but if we don't have the managers on board and the leadership on board, it all just falls flat. So start making those partnerships and collaborations.
Henrique, you mentioned that you were in Japan before returning recently. Could you talk about just the two biggest contrasts that you see between these two healthcare systems and what we could learn over here that you took away from Japan?
Sure. So I think before going to like a comparative study, they probably have to set the context a bit. Japan is a very different society from an American society, right? Diet is different, right? The approach to food is very different, right? The way, actually, let me just ask the crowd, has anyone gone sightseeing in Tokyo or Japan? Do you guys walk a lot? Yeah, well, so that is your typical work day, by the way, right? Because I think over 98% of the Tokyo residents, they take a train. They don't drive to work, right? So going from your home to the train station, out of the train station to the office and get your lunch and all that is 10 to 15,000 steps, right? So that is your average regular day without doing the exercise on top of it, right? So they have different needs and different outlooks as well. The other thing to take into consideration is, again, going back to food, which is very important for them, you are not going to find vegetables and fruit in their supermarket out of season. If it's out of season, you're not going to find it, right? Simple as that. So that means that the food intake is smaller quantities and more nutrition, right? Because it's fresh picked particularly from the season. So that kind of sets up a different context on how health is looked at, right? So that is one aspect. The other aspect is they have universal health care. A citizen is born in Japan, you're already covered for life, right? Obviously, someone has to pay for that, and that comes out of taxes and higher taxes, right? But that sets up an accessibility problem that in the US or other Western countries that have a private healthcare don't have. So they concentrate on that. The other big difference is preventive. And that's where companies come in, for example. As part of your employment, you must do a very comprehensive health check every single year. It's not even a question about whether you want to or not. You have to, right? And that kind of catches all these big diseases that potentially we're waiting for too long to find out. You catch them very early, right? So the companies are really not that much involved in healthcare and benefits because it's obviously universal healthcare. The drawback for that, obviously, is a lot of people go to the doctor almost on a daily basis. It becomes a social thing. So the system gets overburdened, right? And they have demographical issues, which obviously eventually all countries will have. But overall, those are the big differences. Now, outcome-wise, I think that's important to know as well. The average Japanese citizen lives 6 to 8 years longer than American, right? Spend per head or per citizen is about $4,000 a year, all inclusive. In the US, we're talking about maybe $10,000 15,000, right? So we spend a lot more, we get a lot less out of it, right? And then two other aspects that might make some people here, particularly some of the vendors, a bit unhappy, and I'm gonna say it. Drug prices are capped, profit-wise 70%. That's it, right? And insurance companies must be non-profit, right? So that sets up a system that is cheaper to run with basically the same or better outcomes, right? So that's, I think, the big takeaway I had by spending time there.
Okay. You mentioning having to do these annual screenings and doctor's visits is a great segue to a question that I have for Mark and a topic I want to talk about, which has to do with curative and this $0 out-of-pocket model, which I had to do a double check when I first heard about this because it was surprising. Can you explain to me how it works, how it pays off, this aspect about making sure that you're going to the doctor to begin with, all of that?
Yes, yeah, and when you do bring it up, Tom, and honestly, we hear this all the time. We say 0 deductible, 0 copay, 0 out of pocket, and they look at us and go, how can you do that? What's the catch? I go back to something that Enrique said in terms of looking at this. Our catch really is this. We ask our members who are 18 years and older, within the first 120 days when they come on the plan, to interact with us. We believe employee engagement is the key to all of this. And the more people we can get engaged with the plan, they understand what's going on. So in that 120 days, they do what's called a baseline visit. In almost all cases, that's a Zoom call. And you spend a little bit of time with a care navigator who really onboards you to the plan and says, here's what the plan looks like, how you interact with it. Check to make sure your doctors are in network. Just the variety of things that you normally don't get from a health plan, or you usually get something in the mail that you put into a drawer somewhere and then you have to try to find it if you need to use your plan. We try to do that right up front with people so they understand how to use their benefit. In addition to that, there's a second portion of that call that is with a clinician, one of our clinicians that we contract with, that basically goes over their health needs, where they're at right now. Do they have conditions that they know of right now that they're getting treated for? How can we help them in those situations? How can we get them set up to make sure that their prescriptions that they're taking are going to be $0 prescriptions, which, by the way, 98% of our prescriptions are at $0, and how to get care. So many people just don't get care because they have a high deductible, and essentially a lot of people that have employee insurance or employer insurance really are technically uninsured in a lot of ways because they can't go to the doctor because they just financially don't want to do it. So we want to get that right up front, let them know that they have access, help them get set up, make sure we're dealing with their particular issues. Look for gaps in care as well, too. Look for that 50-year-old guy out there who hasn't been to the doctor in 30 years. And there are a lot of those. Find and tell them, listen, there's no financial barrier anymore. We'll help you get set up with an appointment with a primary care doc, get you there to essentially do what we were talking about earlier. Find things out earlier so that you don't have a large claim 2 years down the road or a year down the road. So that's how the plan works. How it pays off is this. We really track a lot of our information, and so if we look at bed days per thousand or average length of stay in the hospital, there's 3 benchmarks that Milliman, the large actuarial firm, uses for health plans. And we all the time come in about 20 to 30% below their benchmark for the best well-managed health plans. So we're trying to keep people out of the hospital. If they go in, they go in for lesser stays. It's paying off already. We didn't expect to see it. We started seeing it within a year, and we've been doing that for now right at 3 years. After about a year, we started seeing that happen. And so the other thing we want to look at, just to make sure everybody understands, is that we will see an uptick in that first year. Usually it's the first 6 months of people going to the doctor. you're going to see that. But we're not talking about an uptick in large claim situations. We're talking about stuff they should be doing on a regular basis. And after that first 6 months, that levels off. We go into the second year, we actually see a drop in cost because people are getting the treatment they need. They're on the prescriptions they need to have, and it's not costing them anything. So essentially, that's where the payoff is. And that becomes, from you on the HR side of it, you have happier employees, you have people that are at work, not absent, and it's a great retention tool for all you talent people out there as well, too.
I want to go down the line. We have about 11 minutes left, so I'm going to jump to some of the questions that I was saving for the end that are sort of forward-looking. So Mark, we'll start here, but I want to go this way. Looking ahead, what do you see as the biggest opportunity for innovation in benefits, whether through tech, new plan models, or cultural shifts?
Well, I could say, obviously new plan models, from our perspective, we look at that and say, but I think with most companies, if you can look at how to innovate with technology within your operations and how you're dealing with members as well too, and be able to be more effective in those dealings and getting things out to employees and members and working with employers so they understand what the tools are that are out there that you can utilize. And I think technology plays a big part. It's something as a growing company and a fairly new company that we've built from the ground up, trying to do that and look at it and actually make changes on a very, very regular basis in terms of what we're doing. We have the ability to be nimble in order to be able to take advantage of AI and all the other technology advancements that are coming up right now. So I think that in dealing with that, along with plan designs and whatever else, I think are the things that can help overcome a lot of the obstacles out there.
Did you have any thoughts on that?
You mentioned AI. I think that was the first time we mentioned AI in the panel.
Yeah.
We did well to last that long. Mine would be AI. And it kind of goes to what we talked about before of the supply and demand challenge, particularly within the mental health space. And check me on this, the healthcare professionals, but one of the best ways to assess a population within healthcare is the step care model. And if you think about the population being your workplace, you have the most amount of people sat in the well bucket, and then as you go higher up, you go through to more severe challenges, and you have at the top of the pyramid the people that need the most severe mental health support. What we've done, quite reasonably and appropriately, is put our highest qualified and most expensive resources aligned to the top, where people need the most critical support. And then on the scale, it goes down to the bottom, where we put our lowest qualified and cheapest resources for the well population. That's reasonable and appropriate because of the supply and demand challenges that we have. What that leaves you with is that the majority of people are getting low quality, not personalized, not consistent, not engaging, underutilized support, whereas the fewest are getting the highest quality. Now, enter AI, because if you can build safe, responsible, ethical AI, you can ensure that across that entire step care model, you're getting access to clinical, personalized, engaging mental health support that is relevant to where you are at that point in time. So I'm not saying give all of the well people therapy, because that's more cost. But give people access to an AI agent, an AI companion. Some of you will be thinking, good God, no, not like the robots, the AI. Does anyone know what the most used or the biggest use case for generative AI is in 2025? Mental health, companionship, or I use the word therapy very loosely. That highlights the problem of access to care, but it also highlights the bigger problem that ChatGPT was not created to be a mental health therapist. There needs to be clinical guidelines created by clinical psychologists, monitored by clinical psychologists. If you get that, safe, responsible, ethical AI, then you can transform some of the access challenges that we were talking to about mental health.
Henry?
Yeah, I think I would tag along on, I'm not sure if AI will play that big of a role. I'm a bit skeptical still, but that's to be seen. I've been wrong many times before, so that wouldn't be the first time. But I think where I see it, at least from a total rewards perspective, having access to the data, it's fundamental. So I think that's where it kind of segues into, right? We know now, at least from within our organization, we know now where the cases are, what issues are popping up where, right? What's the target population? So we can actually intervene much earlier from a preventive perspective, right? I think we just need to accelerate and get better at that, right? The other part, though, is culture was mentioned, right? I do feel that most employees and most people actually still don't take ownership of their health the way they should, right? I think that is still a shift that needs to be made, because what I find strange is that people will spend weeks debating whether to buy a $40,000 car, right? Somehow that does not get translated into, well, what do I need to do to make sure I don't have to go through a $300,000 surgery, right? So I think that part is still not there yet. I think we have a lot of work to do in that space.
Yeah, I do think AI is going to make a major change, but I think in a different way. The vision I have is for this agent that not only says, has the ability to be a therapist for you, or not a therapist, but a companion, but also one that interacts with you and helps you understand when you could be utilizing your health benefits or other programs that your company offers. A companion or a chat agent that says, hey, you missed 3 days of work and that was unplanned and unscheduled. Can I connect you with our clinical care team and you can talk to them about what that was, if that was for you or a family member. As you go through, they say, you utilized your benefits in this way last year. This plan is probably the better plan for you to be on from a cost-conscious perspective. So something that is personalized and tailored to your behaviors. But I also think on the flip side, the big challenge is plan design. What are we still doing? We're still doing a PPO, an HDHP, an EPO, and bucketing these and offering them out, which like 3 plans for 2,500 people and their dependents, you can't really personalize an offer. So the challenge is going to be to start moving to that personalized healthcare and determining ways that we can do plan design that allows for what people need based on their place in life, and not just these large buckets. So how do we do that in a cost-effective way? Lots of data and analytics need to go into that. But that's our challenge over the next 5 years, because the workforce that's coming in, that's what they're going to start demanding from us. They're not going to say like, healthcare is a benefit and a privilege that I have. They're like, healthcare is a basic right. It's an expectation, and you need to deliver it in a better way for this generation. And so we're going to have a hard time with this next generation of workers if we continue on the same path.
Carmen?
I think these have all been tremendous use cases around AI. I agree. I think it holds a ton of promise. I'm trying to think of what would be different. But one of the things that, one of the challenges that we've been long trying to solve is really, how do you communicate the value of total rewards to employees? And I think it goes back to what you're saying. Like, even if you offer an amazing suite of benefits, it's hard to know like exactly what you have access to. So I think having an AI agent helping to engage with you to really help tailor your plan is one thing. Communicating, right? Even you think about it from a retention or an attraction standpoint, communicating the value of total rewards packages to employees to really help them to understand what it is, what they have available to them at their fingertips, I think is great. And I am also bullish on like the AI agent for therapy. So at Yelp, we have actually built and just recently rolled out an AI coach that is trained on our core values. It's trained on concepts around empathy, And it's a much different way than if you just were to go to ask ChatGPT, like give me advice. It'll role play with you. It'll role play both things. And I've been amazed at the efficacy of this coaching model, right? So this is like for everyone. If I'm going to have a difficult conversation with a colleague, maybe help me talk through that. So I do think it holds promise if it's done in a safe and ethical way to give people broader access to mental health and wellness in the workplace. We really experience a challenge with leave of absence because people really do need a break, right? But if you can be more preventative and if you can give people access to those tools at their fingertips at any given time, like how might that work experience change?
Okay. I'm going to try this as our time's running short, but if any of you, or maybe we could go down the line like 10, 15 seconds each, like a final thought in terms of what people here could do in order to increase benefit accessibility. And Carmen, I'll start with you.
I always say listen to your employees. I think employee feedback is a really underutilized tool. It really underpins the way that we design our employee experience at Yelp and how we've evolved it since we really had to transform the whole employee experience since going remote back in 2020. So I think really listening to your employees and what they value and what they need would be my suggestion.
I'll quickly echo what Carmen said, but also help your leadership put themselves in the shoes of your employees. I think that is where I get a lot of disconnect is with an executive leadership team that's like, I haven't scheduled a doctor's appointment for myself in 20 years, so they don't understand what that looks like. Help them understand what your employees are going through to drive that change.
Yeah, I think I tag along as well. Yeah, I think listening is extremely important. Then obviously you have to follow up with that, right? Which is second, probably most important part of it. And third, I think from a mental health, at least from perspective, most of the issues I always pointed out with first manager, right? Your direct manager. I think having that group of leaders be better prepared can be a long way as well to improve and kind of move things in the right direction.
Bit left field, but enhance your maternity policies. The concept of expecting someone to come back after 12 weeks, having birthed a child and gone through that mental and physical experience, for them to be back working at 3 months is ludicrous. So enhance your maternity policies.
Coming from the health plan side, I'll say those of you who work with health plans, communicate with them. Tell them what you want. A lot of us out here in this business are able to adapt and try to come up with new plans, new ideas, new vendors to help in these situations. So the communication part from that side of it to us, we're always looking for. We want to know what you need, what your employees need.
You've been a great panel. Thank you so much for taking the time, and thank you.